Assalamu alaikum. Today we are performing a very informative and very important case for all the gynecologists, radiologists. This is a case of infertility, 5-year married female, and you see this is the echogenic lining in the middle of the uterus, and this is the endometrium. This is cervix, and this is the lining is white lining is endometrium, and you see this is there are two other white areas in the myometrium, posterior wall. These are fibroid. These are not important. This one is rounded ecogenic, and other one is this one. This is also ecogenic, but no, not so important, and this is not causes any infertility. But the other thing I will want to check the this area. You see this is another ecogenic area lining. This is also connected with each other, and when we see the fundus, this is the fundus, and this is the fundus, and there is a mass in the this area, but it is also has a ecogenic lining as a endometrial lining, and it is connected with the uterus. So this is a this one. So this is a rudimentary horn of the uterus, and yeah, this one. This is lining of the endometrium, and these are connected to each other. We also put the Doppler on it to see the vascular areas, and this one the same lining. You see, check the vascular area Doppler. This is the main artery supplying this rudimentary horn. This one is the main artery supplying the rudimentary horn. So this is a very important case, and after this we want to check the ovaries, and the ovaries are one ovary like things seen in the left side. So this one and the small calcified area is seen in it, but there is there are no, this one is calcification in the ovary, but there is no typical follicle seen in it, so it is non-functioning ovary. Other one was not